When I was in school, back in the 70s and the 80s in my public school in New Jersey, there was a nurse at every single school, full time. There was usually multiple, at least one, and often multiple guidance counselors. There were just people there to provide support, so that it wasn't all on the teachers, who already have like 3 times as much work as they probably can reasonably be expected to do in a given period of time. And we have just dramatically scaled back those support systems in our schools. So like nurses have to travel among, God knows how many schools. And so we need to do better by our kids. And when we did legislation a few years ago, SB 1004, to dedicate more of the Mental Health Services Act funds to early intervention and prevention for young people, all of these CSU students just started showing up at the hearings. We hadn't even really reached out to them. They just started showing up because the college-age kids too are in crisis. And COVID, of course, has just put a magnifying glass on every inequity in society, including the lack of access around mental health and addiction care. And we're seeing people are having even greater challenges now. And so there's so much work to do. And I know I'm committed to that work. Our great champion for mental health, Jim Bell, my colleague, Senator Bell, sadly is termed out. And we're going to have to work very hard to make sure that we don't miss a beat. It'll probably take a group effort to replace the work that he was doing as one person, but I know a number of us are very committed to that work. And then we also have to understand the interconnection of housing and mental health. I think I do a lot of work on housing, and it can be very controversial, and I'm okay with that. I didn't run for office to have 100% approval rating. I ran for office to try to tackle like the big issues facing us. And with the exception of like climate change, because that's like the existential threat to the existence of the planet, housing is like right up there. And it interconnects with everything, with homelessness, with poverty, with health, with climate change, with wildfires, with everything. And our broken housing policy has made other problems worse. And when people, if you already have some challenges around mental health, and then you become housing unstable because you can't afford housing, that's only going to make it worse. And when people, of course, become homeless, that's only going to make it worse. And when someone is homeless, it's harder to provide consistent treatment and care. And so we have to work very hard, first of all, to prevent people from becoming housing unstable or homeless in the first place. And that's about protecting renters, especially our low-income renters who were at risk of even further spikes in homelessness in the coming years. And then when people do become homeless or housing unstable, getting them housed again quickly. And we are working very hard to increase the supply of supportive housing for formerly homeless people, so they have the services right there. And some of the legislation that I've authored and others have authored, we're trying to make it easier and faster to build that housing. A lot of times people don't necessarily want supportive housing in their neighborhood, and we have removed some of those barriers by streamlining the approval of low-income housing in general, including supportive housing. And here in San Francisco, which I have the honor of representing, in addition to northern San Mateo County, we've been able to dramatically expedite the approval of supportive housing. So we're very committed to that, and we need to ramp that up around the state, including significant increases in funding. Because the federal government bailed on affordable housing like 40 years ago. Hopefully with the new administration, God willing, we can start bringing that investment back. The state has not done enough. We've started to do more, but we need to go beyond what we're doing. And we just need to be committed to stabilizing people in their homes and getting people off the streets. We also need to really embrace harm reduction around addiction and try new innovative approaches. In San Francisco, this year, in 2018, we had about 270 overdose deaths in our city. Last year, 2019, that went up to 441. And this year, we are on track for like 700 or 750 overdose deaths in San Francisco. That is a moral failure. And so we are very much, and I'll be next year pursuing legislation again. It was vetoed by Governor Brown, but hopefully Governor Newsom will take a different approach to legalize safe injection sites so that we can get people into a safer, healthier setting to do what they were going to do on the streets, reduce infections, reduce overdoses, and with very strong track records with this model of getting people into recovery and then ultimately into housing. And so we're committed to that. We also see really a growing problem, and opioids get a lot of focus, a real growing problem with meth. Meth has no medical treatment. So we are going to do legislation to try to legalize and get funding for something called contingency management, where you provide financial incentives for people on meth and other stimulants to go into recovery and to stay there and to try to get their life back together. So a lot of work ahead, but we're committed to it. And again, I just want to say thank you for the work that you do.
Well, thank you so much for being here. And do you mind, I know you have a hard stop at 11,
yeah.
But do you mind if maybe we ask if anybody has a question, they can put
sure.
it in the chat.
I'm happy to answer a question.
And we'll answer some questions. I have a quick question as we're waiting for people maybe to put in theirs. So when we talk about supportive housing, can you go a little bit deeper into what you mean by supportive housing? Because, you know, for people and families who have loved ones that are in need of some sort of a supportive housing, especially for those people who are living with a serious mental illness, it's important for us to find out from you as lawmakers, what specifically are you talking about, so that as we advocate, we can be on the same page.
Yeah, so typically, and I know this gets complicated because if someone is not homeless, right, if they're living with their family, they're not homeless, and we don't want people to have to become homeless in order to qualify for housing. And so typically when we talk about supportive housing, I think we're often referring to for formerly homeless people, you know, housing with, you know, for that they can afford, whether they have no income or very low income or they're on Social Security or whatever, with wraparound services on site around mental health, around any services that are needed. And it's a very successful model. That model can and should be expanded to people who may not be homeless right now, but are still in a sort of crisis state. And so that is really about the broader need to massively invest in subsidized housing for our low-income communities, whether it's simply people who are working poor, who don't need, you know, a lot of the supports, they just need a place they can afford, or low-income seniors, or emancipated foster youth, or formerly homeless people, or people who are not homeless but really are at severe risk of becoming homeless. And so, you know, it's been very frustrating for a lot of us. We are trying, though, as I mentioned, we've authored several pieces of legislation to basically dramatically expedite building of all forms of low-income housing. Bridge Housing, which is the largest nonprofit affordable housing builder in California, told us recently that due to a law that I authored, Senate Bill 35, their average approval time for affordable housing for low-income people has fallen from an average approval time of 7 years to an average approval time of 4 months. And so that's one step. David Chu authored specific legislation for supportive housing to expedite it, or by assembly member in San Francisco. We are also trying to work to dedicate more land that is specifically for affordable housing for low-income people, including our most destitute and formerly homeless. And so we've done that through certain requirements about surplus property. When a school district or other public agency has surplus land, we want to prioritize it for that low-income housing. In addition, I had legislation this year. It had some hiccups and didn't move forward this year, but hopefully next year, to allow churches and other nonprofits to use their excess land, it might be a parking lot or other excess land, for 100% affordable housing for low-income people. And that, if you think about the amount of surplus land that churches and other religious institutions and nonprofit colleges around California have, it's massive. Absolutely, like transformative, massive. And so if we start unlocking that land, and what the bill would do is automatically rezone it and approve it for low-income housing, even if the local rules don't allow it. It will have, and we know that a lot of churches, it's mission-driven. They want to have housing for people most in need. That could have a transformative effect, because often building low-income housing, you're competing against market rate developers, and it becomes very expensive. This will unlock land and make it more cost-effective to build this housing. And then we have to do more with the funding, which just became a lot harder. And Senator Bell, actually, for the last few years, has been trying to replace redevelopment, which was ended 10 years ago, which was the most powerful tool the cities had to build low-income housing, trying to replace it. And of course, that's off the table now with the collapse in the budget, but we have to renew our commitment.
I would assume too, if that bill that passes about allowing churches and nonprofits, the services that churches and nonprofits could also provide, not only the physical house, but what they could provide as almost wraparound services, makes sense, right? I know in Santa Barbara, they have an amazing wraparounds. It's for people with serious mental illness, and it's NAMI and Mental Health America, and it's an absolutely amazing facility. If you haven't been there, it's inspiring. I know that there are those types of facilities throughout California and LA as well, but I would assume that if that bill passed, then we might be able to see a little bit more of those types of services and housing abilities being able to take place in California.
Yeah, I think so. And there are, churches that have pretty sophisticated, that have sophisticated social services that they provide, but there are other churches that don't, and they would partner with a nonprofit affordable housing developer that already knows how to do supportive housing. Mm-hmm. And so they know how to bring in those services. And often in those kinds of developments, on the ground floor, you would have the services, right? The healthcare or mental health, job training, whatever the case may be.
Yeah, because I think a lot of those nonprofits, I'm even thinking of here in Sacramento, during the winter, there's with a bunch of different churches just in the area, they leave open, yeah. They rotate, right? And they know how to provide the service, but the housing component is something that they may not even know how or what to do. So bringing those two together, I think, would be extremely helpful.
Yeah, and the bill actually requires the church to partner with a qualified nonprofit affordable housing developer, because I think since we're taking some local control away from surrounding communities, we want them to at least be assured that it's going to be a reputable, qualified houser who's going to do it. And because there's obviously a huge diversity of churches, and you might have churches that may do it better than others.
Yeah. And then just to remind you all, if you have questions, please put them in the chat box. We have about 15 more minutes with the senator. I have a quick question, and maybe it's not a question more than it is, our NAMI members, a lot of their family members live with them, right? They're loved ones who have a severe mental illness. There is a big concern that as the family unit maybe is getting older, or they need to move, or something is happening to the parents that were caring for their loved one, where does that individual go? And so I'm curious to find out, with all of the supporting housing, would those individuals qualify for being like in need of housing services?
It depends, and that's why I sort of mentioned this briefly earlier, that supportive housing is often focused on helping homeless people exit the streets and go into supportive housing. But what we don't want is for someone who to have to become homeless in order to be eligible for that. And since you may not get the housing right away, to say, oh, you now have to become homeless and maybe remain homeless for a few years. We don't want to do that. And so I think we have to do better by having that housing available for people who aren't yet homeless but could become homeless. Of course, the whole challenge is that the overall supply, because we're building more of it, and some cities are doing more than others, but we need to do a lot more. It needs to be dramatically scaled up.
I think as we have the housing issue, I have a couple of questions here. The big question within our community is if we can actually have some dedicated housing resources for people with SMI and SUD. Have you thought about that as you're developing legislation?
Well, so, you know, when we fund affordable housing, again, keeping in mind that it's just like not nearly at the scale that it needs to be for the need, we typically don't chop it up into categories, because there are, whether for seniors or emancipated foster youth or formerly homeless or people living with mental health challenges, there's a lot. I mean, we have seen it. Sometimes veterans will get sort of a set aside because there's been such a deep commitment to ending veteran homelessness. But I have not seen that. And I think that could be a good idea, but we'd have to, again, dramatically increase the supply. Because if you're doing a limited amount of funding, it doesn't always make sense to have a whole bunch of categories. And often this is decided at the city and county level. Like in San Francisco, we have the Mayor's Office of Housing and Community Development that administers a lot of the affordable housing funds and makes grants to different nonprofits that are building affordable housing. And there are certain policies and strategies that we want to fund supportive housing, we want to fund veterans housing, we want to fund, and so it's important at the city and county level to have sort of a sophisticated strategy to make sure you're building different kinds of housing. And, the larger cities like in San Francisco or in LA are more likely to have that infrastructure in place. Smaller cities and counties, not so much. So it's not a criticism, they just don't have as much of the infrastructure. So that becomes a challenge as well.
So as we are talking about different options for housing first is always kind of like the big push. And so our advocates probably would say, but we would also love to have some sort of focus on our serious mental illness population, especially those people coming out of the criminal justice system too. Have you guys thought a little bit about what that would look like as well when it comes to being eligible for the supportive housing function?
Yeah, well, we, as we know, and it's, a few years ago when I passed conservatorship legislation, and we were able to pass it, and there was a lot of pushback from some progressives, who just, were concerned that conservatorships could be abused, and that it was somehow criminalization. And what I would say is, listen, we already have a major conservatorship program in California. It's called jail. And when the Los Angeles County Jail system is the largest mental health provider in the entire country, that speaks volumes. And you should not have to go to jail to get mental health services. But what it means is, as we release people from jail, there's a disproportionate population of people who do have these challenges, and we don't want them to, lapse and to lose any progress that they may have made when they were incarcerated. And so there has been more of a focus recently in general on reentry and having more support as people reenter society for, different kinds of services. I know for the last couple of years, We've been in conversation with some of the advocates about trying to ramp up resources for housing, specifically for people who are exiting prison or jail. That has not really happened at scale yet, but that is a known issue. It's something we need to grapple with. And you look like at a San Francisco County jail. Again, we don't want people in jail to begin with because of mental health and addiction challenges. But if people are there in San Francisco County jails, we actually do probably a better job than most jail systems of providing people with access to various services, whether it's getting your GED or mental health services. But then when they're released, if you don't have strong supervision and access to services, including housing, people could so easily just relapse.
Yeah, we got to kind of bridge that gap, right, between prison and community. And I know that there's a lot of great work. I think, having statewide leadership like you have been able to provide for this, like you said, there are many counties that are doing a great job and may have more resources than other counties, but oftentimes it's nice to have that statewide approach so that we know as family members, if I'm living in Sacramento, but my loved one's living in Butte, there's still the ability to have the same sort of service available to them, and they don't have to cross county lines. So I know it's a tough it's a tough place to be because we're 58 counties here in the state of California, and as family members who again have loved ones not only here in the state but throughout, right, of the nation, we have an expectation of how our loved ones, the services should be provided to them. So we have a question here. It says, Latin communities don't have access to learn about mental health, starting that some organizations don't have Spanish classes. What do you think about that? And what can we do about it?
Well, we know, and again, this is another, a teachable moment from COVID, that, communities of color, and particularly Black and Latinx communities and our indigenous communities, and today is Indigenous Peoples Day, to remember the genocide and the erasure that this country committed against Native Americans. And so, we had better come out of this pandemic recommitted to addressing those inequities. And we know specifically in Latinx communities, so in San Francisco, if you divide us into two groups, our Latinx San Franciscans and all other San Franciscans, for all other San Franciscans, as of like a week ago, our positivity rate was, I believe, 1.7%, incredibly low. For our Latinx population, it was like 11 or 12% positive. This is not just like a little bit of a disparity. This is a mega disparity. And that has to do with many things, including overcrowded housing because of our failed housing policies, has to do with who's doing what kind of jobs and what kind of protections they have. It's about people's fear that if they get tested, they might not be able to go to work and support their families and put food on the table. And so it's a huge problem, and there's a big effort in the mission in San Francisco to try to provide those supports. But the same applies with mental health. I mean, because we have viewed mental health as sort of a luxury, it's a little bit like dental care. Dental care it's like a luxury, even though oral health is pretty fundamental to overall health. But mental health has been viewed as a luxury, and you're supposed to just suck it up and deal with it. And if you are, just scrambling just to be able to make ends meet and pay rent and put food on the table and, get your kids to school and living, with, multi-generational or 3 families in one housing unit, it's just like all you can do just to survive and make it through the day and keep your kids on track. And so we need to do more and better outreach so that people know that if they're experiencing these challenges, that the help exists, and that they're going to have access to it. And I agree, you have to be culturally competent and know how to reach communities that that aren't reached in the same way as other communities, and obviously, having ability for people to actually communicate with you in Spanish or any other language is pretty basic.
My mom used to always say, if I had a broken arm, you would know that I was hurt.
Right.
But because I'm dealing with a mental health challenge, it's hard to, one, explain it, and two, for people to understand it. And I think that is not only prevalent in general society, but specifically when it comes to various different communities. And at NAMI, we've done a lot of work in making sure that we're not only culturally competent, but culturally sensitive. And a lot of our programs are adapted to be available to people who are in various different communities, and they were made for and by those communities. And so I think that's the big piece of it too. It's, we can be allies and open the doors, but it really has to be delivered for and by the various different communities that are being served. And so you're doing some incredible work, I know, not only in San Francisco, but throughout the state, in making sure that that's available. We have maybe time for one more question. There's a few questions here, and we'll try and we'll ask your staff if you can take some time. I know you're so busy, but to answer them. Let's see. What are some of the current prospects for supportive housing, not only in the Bay Area, but what through out California, not only now, but in the near future? Do you have a kind of a sense?
Well, I think a lot of it has to do with funding, and I'm sorry that it keeps coming back to that, but that is a lot of it. And so before the pandemic hit, there was a push. We did legislation last year, authored by Assemblyman Chu, to allow the Bay Area to go forward with a regional housing funding measure, a pretty large one. I can't remember the exact amount. Pandemic sort of made me forget. It's like what is it? I guess BC and AC before COVID, after COVID. And so hopefully that'll happen in 2022, along with a major transportation funding measure. And I really want the federal government to go big on housing. I really want to see that, because they used to. Federal government funded, we called it public housing, now we call it affordable housing or social housing. But we need the federal government to start getting involved in housing again in a huge way. And there's more of a push for that. And if we see the right changes next year, we have a shot. Although the economy makes it hard. So that the funding is really critical. Fortunately, Bay Area counties are more open to that funding than others, but it's still huge disparities among the counties.
What do you think, and I'm just going to ask one follow-up, and I'm very mindful of your time, but why do you think it is that there are some counties that have more ability to provide those services, like San Francisco and LA, and while others struggle? Why do you think that is, and how do you think we can maybe advocate to help at the state level for some changes there, so that all counties have the ability to provide it?
Well, I think part of it is just the financial strength or lack thereof of different cities or counties, and then political will. And in San Francisco, we're fortunate. We have the, I think, blessing of being a major city that's a city and the county. We're the only one in the state. And so funding, in California often flows through the counties. And so we don't have to go through the fights of like Oakland versus the suburban parts of Alameda County, right? Where, Oakland has, I think, something like 75% of the homelessness in Alameda County, but only gets half of the homeless funding, and so on and so forth. So San Francisco is also, we have a robust, economy. We have a large general fund. And so we have the ability and also the will. So when redevelopment ended in California, largely in other counties, that revenue that had been dedicated for redevelopment, largely for affordable housing, was scattered to all the other taxing entities. In San Francisco, we immediately went to the ballot and amended our charter to say, no, we're going to create a mandatory affordable housing trust fund, and all of the money that would have gone to redevelopment is going to go into that fund. And so that has, I think, been helpful. We put general fund money, we have passed various taxes and bonds, and so it's never enough, but San Francisco has really done a lot more than almost anywhere else in terms of creating that housing. There are other cities and counties that have the wherewithal, like in LA. There are cities that may have the wherewithal, but they don't have the will. They're not as progressive, and it's just not as high a priority, although that is starting to change. You look at like a San Mateo County, which historically has not, done as much on affordable housing. There's been a sea change there, dramatically more support at the city and county level to fund affordable housing in San Mateo County, and they're all working together. And so we're seeing counties that historically have not done as much that are starting to do more. And of course, I see my friend Sharon joining us. LA is, similar to San Francisco in that there's a big commitment, and LA, has passed major funding measures to help. And so, it requires the funding and the will. And so the state can help on both of those by providing more funding directly, by enabling cities and counties to generate more funding, and also to have better accountability, which is what we've done with some of these streamlining laws to remove some of the local barriers to building this housing.
And I know that Dr. Sharon has a quick question for you before we even segue, because he's going to be our next speaker. But go ahead, John, if you want to ask your question to the senator.
Yeah, I wish that we could. Hey, how are you? Good to see you.
How are you?
I wish we could have some time together. I know that you have to take off. And I mean, one quick comment that, I'm going to be focusing on the severe persistent mentally ill and challenges around homelessness in a larger context. And there's a lot of stuff around funding that I'll finish up with that we can talk about. But the thing that I want to just put out there for you, I have a massive department. About half of our work is done through direct programs and use of our facilities. In the post-COVID future, I believe I don't need more than half of my square footage. So that's me, that's my department. What about the rest of the government at local, state, federal level? What about all the corporate infrastructure that's going to be kind of liberated as we reinvent? And why can't that be used to generate millions of units across this country?
So two things. First of all, I think there are a lot of predictions about what's going to be permanent post-COVID. Someone should write a book about it, just like of all the predictions, and no one's going to go to a sports event ever again. I think that's false. No one's, that offices are going to be a thing of the past. I actually think that's been dramatically exaggerated, and I don't believe that Twitter, for example, is going to be permanent work from home for everyone. We had this, the 1918 to 1920, influenza pandemic that killed 50 million people worldwide, and I think 700,000 or 800,000 in the US. That was, a horrible pandemic. And life returned to normal. Like we didn't. And so I think there will be change. I think there will be more working from home afterwards. I don't know that it's going to be the mega sea change that some are predicting. With that said, I agree. And also, I will also say that, at least this is in San Francisco, might be less so in parts of LA, the run up in cost of office space has pushed out so many small businesses and nonprofits and startups. San Francisco, we were starting to see law firms getting squeezed out. And so I think to the extent there's less demand for office space, prices will come down and we'll have a more, better diversity in our economy. And so I don't want to just go around like obliterating all the office space because it serves an important role. With that said, we did have two pieces of legislation this year to make it much more streamlined to convert on office commercial space that's underutilized into housing. Assemblymember Bloom in LA had a bill. Senator Caballero from the Salinas area had a bill. Neither one passed because we had some unfortunate drama this year, but I think there will be another run at it next year to say that for underutilized commercial office, et cetera, let's make it easier to convert it to housing, because I agree it could. You just look at all the defunct, or not defunct, but declining shopping centers in Southern California, in particular, around the state, but especially in Southern California, that could be redeveloped as housing. So.
Fair enough. Thank you.
Yeah, thank you.
Well, thank you so much, Senator, for your time and for this wonderful discussion. We appreciate all that you're doing and look forward to partnering with you on your work ahead. So thank you.
Absolutely, and thank you for what you do. Thanks for having me. Have a good one. Bye-bye.
And also the